Hello, and welcome back to Battlefield Medicine USA, our historical series exploring how medical science evolved during America's major conflicts. Today, I continue my conversation with Jen Williams, the founder of Kidney Contenders, as we examine the medical realities of the Vietnam War. In this segment, we focus on nephrology and how kidney-related care adapted to the extreme conditions of combat. We also address several common misunderstandings about Vietnam-era medical practices, especially those involving combat medics and evacuation systems like medevac. Jen will walk us through how battlefield medicine advanced during this period and how those lessons shaped modern renal care. Let's begin with her first question. Jen, can you give us an overview of nephrology and the nephrology practices used during battles in the Vietnam War, including how acute kidney injury and other renal conditions were understood and managed at that time?
So during the Vietnam War, nephrology entered a period of rapid change as physicians began recognizing acute kidney injury, or AKI, as a major threat to soldier survival. You had medical teams that gained a clearer understanding. Rhabdomyolysis, it's rhabdomyolysis, spelled Rhabdomyolysis. This was especially in soldiers that were exposed to extreme exertion, crush injuries, and prolonged combat conditions. So the early dialysis was still in what would be considered primitive stages. It became a life-saving intervention for troops who would have otherwise died from the acute renal failure, or ARF. Field hospitals, they did improve the fluid management. They shifted from inconsistent hydration practices to more standardized intravenous therapy, IV, for trauma and heat-related kidney stress. And then you had physicians that documented how infections, antibiotics, and new evacuation timelines all affected kidney outcomes. So at this point, you're giving nephrology its first large-scale data set from a modern conflict. And so you had medevac innovations that meant kidney injured soldiers reached care faster. It allowed earlier intervention and better survival rates. So the Vietnam War really pushed military medicine towards systemic monitoring of electrolytes, renal function, and fluid balance in combat settings. And you start to really understand this more, especially as we go into other wars later on in the 20th century and then in the 21st century. So these advances overall, they laid the foundation for modern acute kidney injury management that was used in both military and civilian medicine.
What are some of the most common misunderstandings about medical practices during the Vietnam War, especially regarding combat medics, evacuation systems like medevac, and early renal replacement therapy, RRT?
Right. So many people, I think, misunderstand Vietnam War medical practices because they assume the care was primitive, when in reality, it actually represented one of the most advanced battlefield medical systems of its time. One misconception is that medics lacked training, but Vietnam era combat medics were highly skilled and capable of performing complex trauma interventions under fire. Another misunderstanding is that evacuation was slow, when the truth is that the medevac system dramatically reduced time to treatment through rapid helicopter transport. Many also believe that antibiotics were rarely used, yet there were widely deployed and significantly reduced infection related deaths because they were actually used very often. And then, of course, some people assumed dialysis was unavailable, but early forms of renal replacement therapy, which is also referred to as RRT, they were used for soldiers that had acute kidney injury, also referred to as AKI. So there is also this misconception that field hospitals were chaotic, but that was anything but the case, when the truth is that mobile Army surgical hospitals, also referred to as MASH, they operated with strict triage protocols. And then another misunderstanding that it was definitely widely believed is that electrolyte monitoring was non existent back then. But the Vietnam War actually marked the beginning of systemic fluid and renal assessment in combat medicine. So, overall, in comparison to those other wars that we discussed in our other videos, the Vietnam War actually pushed military medicine far beyond public assumptions. And it did lay the groundwork for modern trauma and nephrology practices that are used today.